especially related to South by Southwest.
Okay, so the order that's being issued doesn't establish in the order the criteria to be applied. It was the medical advice that based on the criteria that they have and the mitigation that would be necessary, that this event, holding this event was impossible, was incompatible with that. The work continues. It's going to be continuing on today to identify the criteria or whatever are the next appropriate action with respect to unsanctioned and by unsanctioned, we don't mean bad or evil. We just mean events that are not formally under the South by Southwest umbrella. And that additional work will be announced as it is produced and as is available.
Let's go here and then here.
Dr. Escott, you earlier the last thing we got on this was you're assessing, and you even said there's no reason to think that there's a heightened threat. But it's changed completely now, and also I talked to Austin Public Health about a test, the first test that was sent to Atlanta, and they said 48 hours you'll know the results. You know those results, and also expand upon what changed, other than the empirical data or the other data from us.
Sure. So I believe with the evolving situation across the United States, the identification of multiple cases in Harris County and around the Houston area, as well as the fact that we're now testing individuals for the possibility of COVID-19, that raises our level of concern to elevated. We don't have any confirmed cases. We did get a result back on the one that we initially sent. It was negative. We have additional ones that have been sent. We will not communicate every time we get a negative test. We'll tell you the first one's negative, but we will communicate anytime we have a positive result and give you our usual information associated with those cases.
Let's go here, please.
When you mentioned the evidence that it has the capacity to accelerate, can you clarify what you meant and exactly what this panel of advisors were discussing when it came to the hard evidence that you were looking at?
Sure. So there's literature on both sides regarding, do mass gatherings impact the long-term number of people who get sick or die? And that answer is unclear. This is why you see CDC and DSHS has not issued specific information on what should go and what shouldn't. That's based on a threat assessment. But it's important to remember that there is some evidence that because, particularly in this circumstance, there's the potential of bringing people from areas where there is active transmission of disease to our area, that could seed the infection here and cause an outbreak sooner. Now, is that a concern in every circumstance? Not necessarily. Not in the cases where we have vaccines, we have medications which we can treat those. But in this circumstance, part of our national, our state, our local strategy is to delay this as long as possible, because we don't know how soon we're going to identify a treatment. We know that a number of companies are working on vaccine development. And we also know that we have a normal decline in infectious diseases related to colds and flus that happen in the summer months. So we need to buy time. Our effort was to see if there were opportunities to mitigate that threat enough to go on. And the answer is there wasn't a path forward.